Now we are ready to look at the facial bones. And as I mentioned before, we have 14 facial bones. Out of all facial bones we have, the only ones that are not paired are the Vomer bone and the Mandible bone. The inferior nasal concha, maxilla, palatine, zygomatic, lacrimal, and nasal bones are all paired bones. If you add them up, they will be the total of 14 bones. The inferior nasal concha is the third bump that we find in our nasal cavity. And obviously, it is located inferiorly. Remember, the superior nasal concha and the middle nasal concha belong to the ethmoid bone. Now, the inferior nasal concha is not part of the ethmoid bone. It is a bone on its own, and we have one on the right side and one on the left side. The Vomer bone is an unpaired bone. We only have one Vomer bone. And the Vomer bone makes up the inferior portion of the nasal septum. When we look at this anterior view of the skull, we see a small portion of the Vomer bone because the great majority of the anterior aspect of the nasal septum is made by the perpendicular plate of the ethmoid bone. What happens is that the Vomer bone, as you can see here in this sagittal section, has like this triangular shape. And, as I mentioned, it makes up the inferior portion of the nasal septum. But when we are looking at the nasal septum from an anterior view, the great majority of the anterior aspect of the nasal septum that we are looking at is the perpendicular plate of the ethmoid bone. We only see this very small portion of the Vomer bone when looking at it from an anterior view. So the best way for us to see the Vomer bone is in reality from an inferior view, like is shown in this picture, because we can really see the entire height of the Vomer bone. The Maxilla bone is a paired bone. We have one on the right and one on the left side. Together, the right and left maxilla bones form the upper jaw, which is the bone at which our upper teeth insert. If we zoom in this anterior view of the skull, we can see better that the maxilla bone makes up the bony orbit. And together with the sphenoid bone, the maxilla forms the inferior orbital fissure. And we talked about that when I was going over the bone features of the sphenoid bone. Also, from this anterior view, we can see that the maxilla bone makes part of the lateral walls of our nasal cavity and also part of the floor of our nasal cavity. And still looking at this anterior view of the skull, we can see this hole in the right and left maxilla bones, and that hole is inferior to the bony orbit. Consequently, that was named infraorbital foramen of the maxilla bone. Now, when we look at the maxilla bone in this sagittal section, we see that the maxilla is right here, the bone at which our upper teeth insert, and the maxilla bone makes the largest portion of the hard palate. That is the hard palate. And posterior to the maxilla, we have another facial bone making up the posterior portion of the hard palate. And that bone is the Palatine Bone. When we look at this inferior view of the skull, we can see the palatine bones much better. We have the right and left palatine bones, which tells us that the palatine bone is a paired bone. As you can see, the palatine bones, together with the maxilla bones, form the roof of our mouth. And one thing that's very interesting about the palatine bone is that it makes up the roof of our mouth and it goes up. It's a tall bone. And if we look inside of the bony orbit, we can find a very small portion of the palatine bones right there. So the palatine bone also makes up the bony orbit. Another paired facial bone is the zygomatic bone. And the zygomatic bone is the cheekbone. We have the zygomatic bone forming the bony orbit as well. And we have the right and left zygomatic bones. When we look at this lateral view of the skull, we can see that the zygomatic bone has a process that sticks out and connects with the temporal bone. The process of the zygomatic bone that connects with the temporal bone is the temporal process of the zygomatic bone. And the process of the temporal bone that connects with the zygomatic bone is the zygomatic process of the temporal bone. And together, these two processes form the zygomatic arch. Lacrimal bones are the smallest bones in our face. We have the right and the left lacrimal bones. Consequently, lacrimal bones are paired bones. The word lacrima comes from Latin, and lacrima means tears. If you know Spanish, you know that the word lagrima means tears. And since this word means tears, we look for the lacrimal bone in the bony orbit. And we'll find it in the medial aspect of the bony orbit, right there. And when we look at the skull in this lateral view, we can see the lacrimal bone right there, making up the medial aspect of the bony orbit. Zooming in this lateral view, I would like you guys to see that we have a fossa in the lacrimal bone. And a fossa is an indentation, and this fossa was named lacrimal fossa. The lacrimal fossa, this indentation, takes tears from our eyes into a canal, which is called nasolacrimal canal. And this canal is formed by the lacrimal bone, the maxilla bone, and goes all the way inferior to the inferior nasal concha bone. So this canal is also formed by the inferior nasal concha bone. And going through this canal, we have tears. And because of this canal, when we cry and cry and cry, we end up with runny nose. Because our tears are literally being taken into the nasal cavity, besides rolling over our cheeks in case we are crying a lot. The nasal bones are paired bones. We have the right and left nasal bones. And together, the right and left nasal bones form the bridge of our nose. And in case you wear glasses, you rest your glasses on top of the nasal bones. The mandible bone is an unpaired bone. We have one mandible. And the mandible forms our lower jaw. It is the bone that has our lower teeth inserted in it. The mandible is the largest and strongest bone we have in our face. And it is the only bone in our face that we can move. So it's the only movable bone in our face. When we keep looking at this lateral view of the skull, we can see a rounded, smooth surface in the mandible. And that is exactly this part right here. And we had defined before that a smooth, rounded surface is a condyle. Consequently, this is the condyle of the mandible. This is the mandibular condyle. The mandibular condyle of the mandible articulates with this fossa of the temporal bone. This fossa in the temporal bone, this depression in the temporal bone, is the place that will receive the mandibular condyle. Consequently, this fossa in the temporal bone is named mandibular fossa of the temporal bone. And this joint formed by the temporal bone and the mandibular bone is what we call TMJ, temporal mandibular joint. When we go back and look at this anterior view of the mandible bone, we can see a hole on the right side, another hole in the left side, and this is the place that people sometimes put their fingers to think, and they keep thinking, right? So those holes were named mental foramen. So mental foramen of the mandible bone. And when we look at the mandible bone in this inferior view picture, we see that in the medial aspect of the mandible bone, we have a hole there and another hole there. And those holes are called mandibular foramen of the mandible.